So today we're going to do our bubble heat assessment. So I would start by doing my general rules and safety practices. I would knock, identify, and greet, explain my procedure. Hi, my name is Julie. I'm your nurse today. We're going to do your postpartum assessment. So I would start by asking how bonding with the baby is going and try to assess her emotional status and make sure she has a good support system at home. Then I would do a set of vital signs, which includes assessing for pain. Then I'm going to listen. I'm going to listen to our lungs and our heart. And I'm going to go ahead and listen to our bowel sounds. Put on some gloves, and we're going to start with our breast exam. So for the breast exam, we're going to palpate to look for engorgement. We're going to check the nipples, look for symmetry and abnormalities like cracks or bleeding or sores. At this time, I would do some teaching on wearing supportive bra with lightweight pads and no underwires. And if she's breastfeeding, then I would maybe consult a lactation specialist. If she is bottle feeding, then I would explain to her the significance of not stimulating the breast and how not to do that. Then we're going to go down to the uterus. I would support the uterus at the bottom and check for position in centimeters using my fingers. So hers looks like it's about 2 centimeters under the umbilicus. I would palpate to see if the uterus is firm or boggy. If it's boggy, we would want to do further assessment. Could be a sign of hemorrhaging. And I would want to check the position to make sure it's midline. If it's deviated, it could be a sign of urinary retention. So I would have asked her to urinate beforehand, and I would explain to her how to measure her urine and record her output correctly. And I would explain to her the significance of urinating frequently. So we would go to the perineum area next, and I would check her pad for lochia and bleeding, and I would taco that. And I would ask her at this time how many pads she's gone through, how often she's changing her pad, the amount, and the color. So we're going to roll her toward me. I'm going to change her pad underneath her, and I would have tacoed that also. Give her a clean one. I would check the rectum and look for hemorrhoids and check the back side of the episiotomy there. Give her a new pad. Now we're going to check for clots in the leg. So we're going to do this using the Homan sign. So we're going to flex her at the knee, and we're going to check for calf pain when we extend and flex our foot. So we're going to do this with both feet or both legs, and then we're going to check for edema throughout the leg on both sides. She looks pretty good. Then I would ask her if she has any questions, make sure she's comfortable. Before I came into the room, I would have checked her H&H before labor and currently to make sure there's no issues. I would have checked her rubella status to make sure she didn't need the rubella shot, and I would have checked her blood type to make sure she didn't need the Rogaine shot too. And again, I would have assessed for pain during each portion of the assessment to make sure that she wasn't in any pain. And then I would do hand hygiene and report and record.